Uh, Thank you so much for the opportunity to be part of the fourth global conference this year. So my name is Axel Jean-Paul, and my poster entitled Descriptive and Correlational Study of Peritonitis and Haiti. So I would like to introduce Haiti, which is a little country in the Caribbean and American and the Central America with about 12 millions of people as population. And Haiti is known as the first free nation in the world. And unfortunately, today it is considered as the poorest country in the Western Hemisphere. It's been about 50 years since Haiti confronted a chronic and structural organizational crisis impacted mainly the healthcare, where, for example, for the surgery, for the whole country, there's only about 180 surgeons and more than 19 of care facility, 90% of care facility have no capacity to provide surgical care. So the presentation is about peritonitis, considered as the most common emergencies in the surgical department, and the third most common cause of surgical abdomen. And the things about peritonitis is the severity. That's why today they use the Mining Peritonitis Index as a score to predict the prognosis of patients with peritonitis, and the MPI, the Mining Peritonitis Index, have a high accuracy. So this study is the first describing the gravity of peritonitis in Haiti, and the main of the study was to describe the characteristics of patients with peritonitis and also to evaluate the association between gravity and some variables. So it was a cross-sectional study conducted in the surgical department of the State University of Haiti over about six years, and we collected 91 patients operated in the surgical department as population for the study. The main results are presented here, where in our cohort there were more men than women, and the mean age was about 27 years. And also, the most important result was about the delay, where we observed the patient took about 7 days to come to hospital after the beginning of symptoms. And also they spent about 4 days in the pre-op home and 10 days about in the post-op rooms. The MPI score, the gravity score, the mean was 23.3, and the MPI score was significantly associated with age, with healing of symptom, duration in pre-op, duration in post-op, and total duration. And we also observed that hospital delay were correlated significantly with age, group age, and also with sex, and also with MPI score. And the MPI score was significantly correlated also with age, temperature, blood pressure, creatinine, urea, and delay in pre-op. When we analyze this for a multilinear regression, we observe that only creatinine, pre-op delay, and age was influenced by the severity score. So there was a strong correlation between these three variables, and the creatinine, for example, 52.9% of variation of MPI score was due to creatinine. And also we observed that 27.6% of MPI score variation was associated with the pre-op delay. And lastly, 27.4% of MPI score was variated with age. So, as mentioned before, there were more men than women in our cohort, and this observation was similar from some international study, and both in developing and developing countries. And also, we have observed that the mean age of our patient was 27 years, that which a little bit lower from developing country, but closely similar with some developing country. Our patient took about 7 days to come to hospital, or the recommended time to come to hospital after beginning of symptom of peritonitis was about 3 days. And also we have observed that they spent about 4 days in pre-op time and pre-op room, or the goal or the standard was to spend less than 24 hours. So, and in our study, we was used a correlational descriptive methodology, which reveals only correlation between dependent and independent variables. We're talking about the gravity and the other variable, but does not allow us to confirm any causality relationship between those variables. Also, the sample was a little bit later because there was only 91 patients, but the study shows a disproportionate prevalence of peritonitis for patients between 15 and 40 years of age, and also those of male sex. Creatinine or creatinine level, age, and preoperative delays are the primary factors related to gravity, and these findings cover the importance of assessing the MPI severity score and management of peritonitis, especially in situation of locality where they have a lot of lack of access. So thank you. Those are the reference of the study. Thank you so much.